Ultra-processed foods and early death. Written by Michaela Conley. There is strong scientific evidence that ultra-processed foods are linked to severe health risks, including cancer, cardiovascular and liver disease, and dementia. The evidence shows that these hyperpalatable foods, which usually include high amounts of sugar, salt, and artificial additives, are also linked to early death or increased all-cause mortality. The term all-cause mortality refers to deaths in a population from any cause. What is the evidence linking ultra-processed food and all-cause mortality? A meta-analysis published in the American Journal of Preventive Medicine in April 2025 showed a linear dose-response association between the ultra-processed food consumption and all-cause mortality. The researchers conclude the findings support that ultra-processed food intake contributes significantly to the overall burden of disease in many countries, and its reduction should be included in national dietary guideline recommendations and addressed in public policies. A multi-center prospective cohort analysis in 9 European countries published in The Lancet in January 2025, including 428,728 participants, found that ultra-processed foods were positively associated with all-cause mortality, as well as mortality from circulatory diseases, cerebrovascular disease, ischemic heart disease, digestive diseases, and Parkinson's disease. Replacing processed and UPFs with unprocessed/minimally processed foods was associated with lower mortality risk. In a population-based cohort study that included more than 115,000 people, scientists investigated the link between ultra-processed food consumption and all-cause mortality. The research, which was published in 2024 in BMJ, found that compared with those in the lowest quarter of ultra-processed food consumption, participants in the highest quarter had a 4% higher all-cause mortality. Ready-to-eat meat products like processed meats, along with artificially and sugar-sweetened drinks and highly processed breakfast foods, were also associated with higher all-cause mortality. A 2019 prospective cohort study published in BMJ found that a higher consumption of ultra-processed foods was independently associated with 62% relatively increased hazard for all-cause mortality. For each additional serving of ultra-processed food, all-cause mortality increased by 18%. Researchers came to these results after examining the data of nearly 20,000 study participants ages 20 to 91 years old, following up every other year between 1999 and 2014. They separated the type of consumption of ultra-processed foods into 4 categories: low, low-medium, medium-high, and high consumption. The study authors concluded, discouraging the consumption of ultra-processed foods, targeting products, taxation, and marketing restrictions on ultra-processed products, and promotion of fresh or minimally processed foods should be considered part of important health policy to improve global public health. Published in JAMA Internal Medicine in 2019, an observational prospective cohort study that examined the eating habits of nearly 45,000 middle-aged people in France found that after adjusting for various confounding factors, a 10% increase in one's proportion of ultra-processed food consumption was statistically significantly associated with a 14% higher risk of all-cause mortality. They concluded, an increase in ultra-processed foods consumption appears to be associated with an overall higher mortality risk among this adult population. In an umbrella review published in 2024 in BMJ, researchers examined the consumption of ultra-processed foods and the risk of various adverse health outcomes. Using data from 45 analyses, researchers found direct associations between exposure to ultra-processed foods and 32 health parameters spanning mortality, cancer, and mental, respiratory, cardiovascular, gastrointestinal, and metabolic health outcomes. And based on the pre-specified evidence classification criteria, convincing evidence supported direct associations between greater ultra-processed food exposure and higher risks of incident cardiovascular disease, related mortality, and type 2 diabetes. The researchers concluded, these findings provide a rationale to develop and evaluate the effectiveness of using population-based and public health measures to target and reduce dietary exposure to ultra-processed foods for improved human health. A prospective cohort study published in 2022 in BMJ investigated the rate of all-cause mortality as it related to individual diet and ultra-processed food intake in nearly 23,000 adults. Researchers found that adults with the lowest quality diet and the highest ultra-processed food consumption were at the highest risk for all-cause and cardiovascular mortality. A significant proportion of the higher mortality risk associated with an elevated intake of nutrient-poor foods was explained by a high degree of food processing. A 2021 meta-analysis published in the British Journal of Nutrition examined all observational studies that explored the link between eating ultra-processed foods and health status. The researchers wrote, for prospective cohort studies evaluating a total population of 183,491 participants followed for a period ranging from 3 to 5 to 19 years, highest UPF consumption was found to be associated with increased risk of all-cause mortality in 5 studies. Published in 2019 in Public Health Nutrition, a prospective analysis reported the frequency of ultra-processed food intake between 1988 to 1994 and its associations with all-cause mortality. The results showed that, over a median follow-up of 19 years, individuals in the highest quartile of frequency of ultra-processed food intake, egg sugar-sweetened or artificially sweetened beverages, sweetened milk, sausage or other reconstructed meats, sweetened cereals, confectionery, desserts, had a 31% higher risk of all-cause mortality after adjusting for demographic and socioeconomic confounders and health behaviors. An analysis published in the American Journal of Nutrition in 2023 examined consumption of ultra-processed foods and risk of death and major cardiovascular disease from several different regions of the world. The research included data of more than 138,000 people who did not have a medical history of cardiovascular disease on 5 different continents. The researchers found a diet high in UPFs was associated with higher risk of mortality and non-cardiovascular mortality. The researchers concluded, globally, limiting the consumption of UPFs should be encouraged. A systematic review of observational studies published in Nutrients in 2021 examined data of more than 200,000 people to observe associations between ultra-processed food and adult mortality risk. The results revealed that each 10% increase in UPF consumption in daily calorie intake was associated with a 15% higher risk of all-cause mortality. The dose-response analysis revealed a positive linear association between UPF consumption and all-cause mortality, CVDs cause mortality, and heart-cause mortality. The researchers concluded, it seems that higher consumption of UPF is significantly associated with an enhanced risk of adult mortality. In a 2024 study published in the journal Clinical Nutrition, researchers sought to evaluate the link between ultra-processed food consumption and all-cause mortality, cardiovascular disease, and cancer. Using data from more than 1,500 individuals in Spain, study authors found that, compared with participants in the lowest tertile of UPF consumption, those in the highest tertile showed 40% higher risk of all-cause mortality, CVD mortality, and of cancer mortality. They concluded, considering the increase in UPF consumption and their detrimental health effects on mortality, further prospective studies should be carried out to confirm if UPF consumption also increased the incidence of CVD and cancer, and consequently, to enhance more attention should be put in population nutritional education and nutritional policies. Researchers in Brazil sought to understand how ultra-processed food affects the risk of premature death by using a comparative risk assessment model, along with diet and demographic and death rate statistics. The data included that of more than 500,000 people. The results of the 2023 study, published in the American Journal of Preventive Medicine, showed that the consumption of ultra-processed foods was responsible for approximately 57,000 premature deaths, or 10.5% of all premature deaths in Brazilian adults aged 30 to 69 years. Reducing the contribution of ultra-processed foods to the total energy intake by 10%, 50%, could potentially prevent 5,900 deaths to 29,300 deaths, respectively. The study authors concluded the consumption of ultra-processed foods represents a significant cause of premature death in Brazil. Reducing ultra-processed food intake would promote substantial health gains for the population and should be a food policy priority to reduce premature mortality. Journalism and opinion. High levels of ultra-processed foods linked with early death, brain issues by Anna Hatt O'Connor, Washington Post, May 8, 2024. Nutritional psychiatry professor Phyllis Jacka. The global food system is the leading cause of early death. Interview by Callum Baines, Guardian, October 21, 2023. Death is Not the Enemy, by Dr. George D. Lundberg, Medscape, June 26, 2023. Eating Processed Food, Tied to Shorter Life, by Nicholas Bakaler, New York Times, February 12, 2019. More evidence links ultra-processed foods to premature, preventable death, by George Citroner, Healthline, November 7, 2022. Ultra-processed foods contribute to disease and early death. Why do we keep eating them? By Michael Lecourt Salon, December 12, 2022. Ultra-processed food are easy, cheap, and could be killing you. By Susan Scuddy, CNN, May 30, 2019. We are trapped in a junk food cycle that is making us sick. By Henry Dimbleby and Jemima Lewis, New Scientist, March 29, 2023. Heavily processed food like ready meals and ice cream linked to early death, by Anne Sample, Guardian, May 29, 2019. We are producing a series that reports on the science behind the health risks of ultra-processed foods. Learn more about ultra-processed foods and their health risks at our other fact sheets on cardiovascular disease, depression, dementia, addiction, type 2 diabetes, obesity, and cancer, along with our fact sheet offering a general overview of UPFs here. These fact sheets are works in progress and will be regularly updated.